Which federal law requires that medications dispensed by pharmacies must include child-resistant containers unless otherwise requested by the patient? A. Controlled Substances Act. B. Poison Prevention Packaging Act. C. Food, Drug, and Cosmetic Act. D. Drug Supply Chain Security Act. Answer, B. The Poison Prevention Packaging Act mandates child-resistant containers to prevent accidental ingestion, with exceptions if the patient or prescriber requests non-child-resistant packaging. Which schedule of controlled substances has no accepted medical use in the United States? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer, A. Schedule 1 substances, such as heroin, have no accepted medical use and are considered to have a high potential for abuse. How often must the DEA registration for a retail pharmacy be renewed? A. Every year. B. Every 2 years. C. Every 3 years. D. Every 5 years. Answer, C. A DEA registration for a retail pharmacy is valid for 3 years and must be renewed before expiration to continue dispensing controlled substances. The Combat Methamphetamine Epidemic Act limits the sale of pseudoephedrine to no more than how many grams per day? A. 1.5 grams. B. 3.6 grams. C. 5.0 grams. D. 9.0 grams. Answer, B. The daily limit is 3.6 grams per customer to help prevent illegal production of methamphetamine. Which DEA form is used to order Schedule II controlled substances? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer, C. DEA Form 222 is used to order, transfer, or return Schedule II controlled substances. Which of the following is a responsibility of the FDA? A. Regulating the state licensing of pharmacies. B. Approving new prescription drugs before marketing. C. Scheduling controlled substances. D. Managing Medicare reimbursement rates. Answer, B. The FDA ensures drug safety and efficacy by approving new medications before they are marketed. What must be documented when a partial fill of a Schedule II prescription is given? A. Patient's consent form. B. Remaining quantity and date of fill. C. DEA license renewal date. D. Pharmacist's continuing education record. Answer, B. Federal law requires recording the amount dispensed, the amount remaining, and the date to ensure compliance. Which law created the requirement for drug utilization review, DUR, in Medicaid programs? A. Omnibus Budget Reconciliation Act of 1990. B. Controlled Substances Act. C. Food and Drug Act of 1938. D. Medicare Modernization Act. Answer, A. OBRA 90 requires pharmacists to perform prospective DUR for Medicaid patients to ensure appropriate medication use. The DEA requires theft or significant loss of controlled substances to be reported using which form? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer, B. DEA Form 106 is used to report theft or loss of controlled substances. Which statement about prescription record retention is correct under federal law? A. All prescriptions must be kept for 1 year. B. Controlled substance prescriptions must be kept for at least 2 years. C. Non-controlled prescriptions can be destroyed after 3 months. D. Records are only required for Schedule II drugs. Answer, B. Federal law mandates keeping prescription records, including controlled substances, for at least 2 years. Which act requires pharmacists to provide counseling to Medicaid patients? A. OBRA 90. B. Pure Food and Drug Act. C. HIPAA. D. Hatch-Waxman Act. Answer, A. OBRA 90 includes provisions for mandatory counseling to improve patient safety and drug therapy outcomes. Which agency enforces the Controlled Substances Act? A. FDA. B. DA. C. OSHA. D. CMS. Answer: B. The DEA enforces regulations related to controlled substances, including distribution and record-keeping. HIPAA regulations require pharmacies to provide which document to new patients? A. DEA license copy. B. Privacy practices notice. C. Drug recalls report. D. Medication guide for all drugs. Answer: B. The notice of privacy practices informs patients about how their protected health information is used. Which DEA form is used to destroy outdated controlled substances? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 363. Answer: A. DEA Form 41 documents the destruction of controlled substances to maintain compliance. The Drug Supply Chain Security Act requires what type of system for tracking drugs? A. Daily reconciliation log. B. Electronic pedigree system. C. Manual inventory count. D. Patient consent form. Answer: B. The DSCSA mandates an electronic track and trace system to protect against counterfeit drugs. Which federal law first required proof of drug safety before marketing? A. Controlled Substances Act. B. Food, Drug, and Cosmetic Act of 1938. C. OBRA 90. D. Poison Prevention Packaging Act. Answer: B. The FDCA required manufacturers to prove a drug's safety before it could be sold. When transferring a Schedule IIIV prescription, what must be documented? A. Number of refills authorized and remaining. B. Pharmacist state license renewal date. C. Manufacturer lot number. D. DEA inspection report. Answer: A. Transfer records must include refills remaining, original prescription date, and pharmacist details. Under the Controlled Substances Act, how are drugs classified? A. By manufacturer. B. By abuse potential and accepted medical use. C. By price. D. By dosage form. Answer: B. Controlled substances are placed into schedules based on abuse potential and accepted medical use. Which act requires that all medications bear adequate directions for use? A. Durham-Humphrey Amendment. B. Pure Food and Drug Act. C. Kefauver-Harris Amendment. D. Hatch-Waxman Act. Answer: B. The Pure Food and Drug Act mandates accurate labeling with directions for use. Which DEA form is required for a new pharmacy to register to handle controlled substances? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer: D. DEA Form 224 is used by pharmacies to initially register for dispensing controlled substances. Which DEA form is required to order Schedule II controlled substances? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer: C. DEA Form 222 is the official order form for Schedule II controlled substances under federal law. It must be completed, signed, and retained for at least 2 years for audit purposes. A patient's prescription label for a controlled substance must include which additional detail compared to a non-controlled drug? A. Patient's age. B. Date of prescriber's license renewal. C. Federal transfer warning. D. Pharmacy website URL. Answer: C. Federal law mandates that all controlled substance labels contain the statement, "Caution, federal law prohibits the transfer of this drug to any person other than the patient for whom it was prescribed." What is the maximum number of refills allowed for a Schedule III controlled substance? A. 2 refills in 6 months. B. 5 refills in 6 months. C. 12 refills in 12 months. D. Unlimited refills for 1 year. Answer, B. Schedule 3 and 4 controlled substances can be refilled up to 5 times within 6 months from the prescription date according to federal law. If a pharmacy discovers a theft of a controlled substance, which DEA form must be completed? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 363. Answer, B. DEA Form 106 is used to report theft or significant loss of controlled substances and must be submitted to the DEA and local law enforcement. Which act established the Drug Enforcement Administration, DEA? A. Controlled Substances Act of 1970. B. Pure Food and Drug Act of 1906. C. Food, Drug, and Cosmetic Act of 1938. D. Combat Methamphetamine Epidemic Act of 2005. Answer, A. The Controlled Substances Act of 1970 created the DEA to enforce laws related to controlled substances. The Combat Methamphetamine Epidemic Act limits the daily sale of pseudoephedrine to A. 2 grams per day. B. 3.6 grams per day. C. 5 grams per day. D. 7.5 grams per day. Answer, B. Under the CMEA, the maximum daily sales limit for pseudoephedrine is 3.6 grams per purchaser to reduce illegal meth production. Which federal schedule includes drugs with no currently accepted medical use and high potential for abuse? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer, A. Schedule 1 drugs, like heroin and LSD, have no accepted medical use in the United States and are considered the most dangerous. How long must controlled substance records be retained under federal law? A. 1 year. B. 2 years. C. 5 years. D. 10 years. Answer, B. Federal law requires pharmacies to keep all controlled substance records, including DEA forms, for at least 2 years. Which of the following would be considered a Schedule 4 controlled substance? A. Codeine with acetaminophen. B. Alprazolam. C. Fentanyl. D. Heroin. Answer, B. Alprazolam, Xanax, is a benzodiazepine classified as Schedule 4 due to lower abuse potential compared to Schedule 2 or 3 drugs. What is the purpose of a DEA Form 41? A. To order Schedule 2 drugs. B. To register a pharmacy with the DEA. C. To document destruction of controlled substances. D. To report theft of controlled substances. Answer, C. DEA Form 41 is used to record the destruction or disposal of controlled substances, ensuring proper compliance with DEA regulations.